Different than our typical standard ABIs where you get a systolic and diastolic pressure, BlueDop gives you a mean perfusion pressure. And off that, from that Doppler waveform, and off that mean perfusion pressure, you can compare it to that central arm perfusion pressure, which gives you your ABPI, and it's a mean ABPI. So what does that number mean? That's basically the mean blood pressure at the ankle. And that number is important. We know that a mean perfusion pressure or a perfusion pressure of greater than 40 is associated with wound healing. So if that number starts dropping below 40 millimeters of mercury, that's a big deal. Now, the likelihood that a wound will heal is significantly less than if it's over 40. And we know that when the number is less than 40, the likelihood that that wound will become infected is going to be significantly higher than if it's over 40. So that number is important as we revascularize limbs. We're going to be able, with BlueDop, to follow that mean perfusion pressure at the ankle, which is going to give us some confidence that, one, we revascularize that patient to a state where they can heal that lower extremity wound and save that limb.